been looking forward to this tea all semester, as I'm sure several of you have. We've got a wonderful guest, Subhrendu Pattanayak, who does a lot of work kind of with modeling how different parameter changes would change social behavior in a policy context. So I think it really fits in with some of the developing interests here at the GUND around behavioral economics and kind of response of societies to policy changes and actually getting some kind of complex systems modeling lens on that. So I think he's a really great match for this group and where we're going. And as I'm sure you have been told, we've had a one-credit course in the fall on sort of behavioral economics, and so I think it fits in well with that interest. So there's kind of some knowledge in the room about that. So he's a professor of public policy, environment economics, and global health at Duke University, so quite a batch. And he studies how human behavior relates to the environment by collaborating with ecologists, epidemiologists, statisticians, and other social scientists. Also a very GUND approach to studying problems. Toward this end, he attempts to build models that analyze the causes and consequences of human behaviors, and uses estimated parameters to integrate in integrated simulation tools to help design behavioral interventions, also known as policy tools.
Where did you find all that stuff?
The wizard of Google.
Is it all live?
You can disabuse us of all these notions. So he has a PhD in environmental economics from Duke, an MS in economics from Purdue, and a BA in economics from St. Stephen's College. So a really great match for this group, and I hope we can really benefit from having him here and his presentation. So with that, I'll turn it over to you.
Thank you. Thank you, Gun. Thank you, Taylor and the whole group for inviting me down here. It's, when Bob Costanza came here many years ago, we all wondered what was going on in Vermont and what would happen. And so I'm very glad to have the chance here to follow up after so many years. I was given two instructions. One is that I should find a pair of Birkenstocks, otherwise. But they kept me busy all yesterday, all the way till till late at night, and so I couldn't do any shopping for Birkenstocks. And the second one was I was not to talk down to any of you. So that means I'm going to get my knees here. I'm sorry, my knees are bad, so I'm going to have to stand up. But what I'll do to not talk down is I have lots of slides in which, in some cases, I'm just going to blast through them because you obviously know this all. But no, because I understood this to involve at least 30 minutes of Q&A and discussions, and so I have about 30 slides, which I'll go through really quickly, but then there's a section which I can drop depending on how fast or slow we're moving on sort of a reflection point. What if Gordon Moore and Bill Gates went out to coffee or to the GUND tea? What would they discuss? Okay, so after I presented my main arguments, I will sort of reflect on that, and we can have that as a more free-flowing discussion. And I also apologize in advance to Joe, who's probably seen a version of this many years ago. That was almost, what?
Like 10 years
ago. Yeah. So it's a slow-moving project in some ways. Pieces of it have come out here and there, but the main thrust of the argument hasn't been made. And you can see probably why it's hard to prove A or B and then come to conclusions about C and so on. So that's one reason. And Taylor and Alicia have seen some shortened version of this in a sort of a very tumultuous environment of NACAP where people go off and do crazy things. I know I won't get through most of this, so I'll just say this up front. These are really the most critical slides of the discussion. This crowd probably appreciates this better than 99% of the world's population, but it's important to restate that ecosystem degradation, especially in the tropics, is more rapid than at any time in human history. And the case for ecosystem services is because these haven't been recognized. Not only have they not been recognized, but they are public goods, so by definition it's hard to get them provided. But also they benefit the politically weak, so now you have not just the market failing, but the politics failing, and so nothing really panned out. One of the ecosystem services that is disease regulation by intact ecosystems are probably the most significant. Some people have alleged that they contribute to maybe half the world's health, maybe a third. Still, that's a big number. But schools of medicine are not saying that, so that's a concern for the rest of us. Especially against the context of climate change, which is going to make things really much worse for all those people. Okay. So that's a good conceptual kickoff statement, but then everything falls apart, because to really understand how they work, and when people like us try to model them, we find that the causal chain turns out to be pretty complicated. We tended to do more convenient stuff than the harder stuff, and we tend to work with convenient methods rather than the hard methods, and so that's why we don't come to any grand conclusions. I say applied economists here, it's applied social scientists. So anyone who really cares about policy, programs, or projects, that's what I mean by applied. And once you're there, you're not really an economist, you're whoever, you're just working on the problem, right? So I think this crowd appreciates that, again, more than 90% of the people I'll be talking to. We bring a somewhat sobering perspective because we consider that's lots of things going on. We can't say water quality going bad and diarrhea going up. There's a lot more things that happen, especially behaviors. And so I will offer some evidence from the Brazilian Amazon, where the presence of protected areas, which are sort of operating on multiple channels and mechanisms, might be affecting vector-borne diseases like malaria, potentially dengue, cardiovascular outcomes, as well as respiratory outcomes, which I won't present today, but that's of interest. And then sort of the second but last slide, important slide, more stuff, is that we tend to focus on, well, what does a social scientist have to contribute to this discussion between the environment going bad and health going bad? It should just be epidemiologists talking to environmental scientists. Why should social scientists have anything to say about that? Because people and institutions and communities, thankfully or unfortunately, respond to the changing settings, and if you don't account for that response, you either over or under misestimate the nature and sign of the causality. But also, this whole concept of service is so closely tied to the human behavior. When we do something, we appreciate its value, and so we lose those signals if we don't model this stuff. I won't talk about some of the other work that we've done, similar kinds of things in Indonesia. Taylor and I have already talked about this all of yesterday and today, so I'll spare you that. I also won't talk about the exercise of going from cases of malaria deaths avoided and instances of sickness events avoided to values. I mean, can we then turn around and say the Amazon is worth? Okay. But it can be done. So a little bit of talking up, talking down, background stuff. Those few who have sort of defined or are trying to figure out your research career, there's a whole crowd of people who are doing this as a valuation project. How does intact ecosystems contribute to human welfare? And today I'll be turning on the health channel and talking about the health channel, how it works and contributes to human well-being. There's another set of you who are probably working on the types of institutions that might or might not deliver these outcomes, and those will be the institutional folks. And then there's another set of folks who are sort of interested in whether specific projects, programs, policies, protected areas, payments for ecosystem services, community forest management, deliver efficient, equitable, viable, sustainable outcomes for these evaluation questions. There are all kinds of conceptuals and modeling questions involved in all of this, and the broad issue here is we are trying to value the services flowing from intact ecosystems so we can evaluate programs that deliver and conserve nature. Okay, so Parker Rasputin has sort of often talked about this as evaluation questions feeding off each other. You do a lot of ecosystem services evaluation. I'm just going to skip through most of this. Yeah. Okay. Let's just keep this graphic in mind. The MEA kind of set the tone for a lot of this, and I don't know. The MEA has 1 million citations already, or something like that, right? That's because people sort of appreciate there's things going on in the world. Some of them support more specific things which can be clubbed into provisioning, regulating, and cultural services. And we could spend the next millennia trying to slice and dice that and call it, well, it's not regulating, it's this, and fine. I don't want to get into that taxonomy, it's just too much. But that makes us happy in some ways. Well, okay, in what ways? And then again, you can spend the next millennia, after the previous millennia, slicing and dicing what these are. Fine. I just want to know, on one of these arrows, what is the size of that effect when you're talking about specific health outcomes? So in that same MEA, one of the synthesis chapters will be talking about how these different kinds of impairments to the ecosystem has direct effects, ecosystem-mediated effects, and indirect effects. So today's discussion is about this, recognizing that there's other things in play. Whether those are more important or not, I don't know for sure, but this is the one that we're sort of focusing on. Because we find that tends to get left out, because indirect ones means that the migration group is sort of worrying about this. Direct ones means that the flood mitigation crowd is worrying about this. But this ecosystem-mediated one is the one that ecosystem services people are sort of interested in. That's where you could take that graph and throw it away, and then there's this shitty paper that came out recently. We'll just do the same thing, but in a different way. Here we have
Miscited, I might add.
miscited. I just put it on top of it just to show that you could replace it with something like this, which sort of tells the story in a different way. Okay, but these are obviously this analysis hasn't gone away. The fact that, what is this, 2014, is it forthcoming or is it actually out now, in print?
It's out.
It's in print. So in 9 years later, we're still saying that this has to be studied. That means ecosystem-mediated health impacts have not populated the world's knowledge base, and there's a lot more to be done, and so I'm still in setup mode. Okay? Why is this a big deal? The WHO every now and then steps back and says, let's count up all the dead people in the world, and all the sick people, okay? And that we call the global burden of disease. And then do some crazy attribution exercise, and statisticians are involved, and then carve it up and say, what burden of the disease is explained by X, okay? And so some of the ones that are most environmental, so for example, just as an example, diarrhea, 4% of the global burden of disease is attributable to diarrhea. Of that gray diarrhea row, 95% is environmental because it all is water quality related, right? So if you start adding up those little green bars, you will pretty soon end up with something like 30% of the global burden of disease. What the School of Medicine should be paying more attention to is environmentally mediated. Okay?
No cancer?
No cancer in this chapter. Okay? So this is a very gross underestimate of what's going on. We are not even looking at malnutrition links, all kinds of other things. So, if this is potentially there, should we not be doing more to deal with health through maintaining ecosystems? And the question is, we often puzzle over these numbers and say, where did this come from? Let me just try seeing if this is true in one setting, and that's what I'm trying to do. Okay. Climate change is obviously making this even more prominent. There's a series of papers in the Lancet, which is sort of the holy grail for some people. Talking about human health impacts, vulnerability mitigation, how can we sort of avoid future risks, etc., etc. Okay? And as you will see, bad things are going to happen. Global greenhouse gases or greenhouse pollutants, something off on the left side. And there's a bunch of things on the environmental domain that we can think of it, which might or might not lead us to these adverse outcomes. If you don't do those things in the middle column, then you'll have these bad things. Okay, so this is where nature can serve as a form of insurance. So you have natural insurance, and that's all conceptual stuff. Yeah. Again, this is that crazy paper that some crazy people wrote, and they said we should worry about this. Okay. Some of the conclusions that our work reflects to now focus on single health outcome. I won't show you the other health outcomes, so we just directly respond to this. I had a chance to actually review that paper, so it's not unrelated that I have something to say about these. We focus on multiple environmental channels. We look at different kinds of protected areas. We look at roads coming in, so there's a lot of stuff going on. We don't do a good job of this in this analysis in Brazil, but we have other places on other sites where we've been looking at that. But more importantly, we focus on that third pathway where the poor don't have the ability to escape and get infrastructure and services and healthcare that sort of breaks the link between the environmental exposures and the health outcomes. A not so crazy review that Paul and I and others have done has sort of started looking at health effects in different settings, air quality, flood-related respiratory infections, and by and large what we've concluded is it's mostly the valuation exercises are ad hoc and one-off here and there. They're not closely tied to specific policies on the ground. Policy evaluations themselves don't apply the same rigor that we do, say, for trials or for other things where we are going to give someone a blue pill. I mean, we think a lot before we do it. We don't do that for policies. We should, because those are expensive enterprises as well. And so the call that we make in that paper is better integration of combining valuation and each program or impact evaluation studies and sort of certainly paying attention to behaviors. And I'll come back to this in the reflection stage. Okay, so what's going on in Brazil? Why Brazil? We focus, so when you say we look at deforestation as a risk factor for malaria, 99% of the time if there's more people from a biomedical type of background, this seems like you are insane. Malaria happens when a person shows up in the hospital and with these symptoms and they treat this and to tell them that it's something in the community where they're living and those factors, it's not a starting point, but so my job is to keep making that a starting point. Like you should think about where the disease started. And so, well, mosquitoes are to blame. When you change the vector ecology, that's one mechanism. You could be altering the microclimate. If you're talking about clearing a good part of the Amazon, then you will certainly affect the things like climate and microhumidity, temperature, rainfall, potentially. Jonathan Patz and others have said that it operates through a species channel by changing things that eat mosquitoes and their larvae, maybe. I don't know. I'm not going to run around counting them up. What I'm most interested in is that people are just not. Deforestation is the beginning of a whole chain of activities. People start going into the forest when they want. But they start moving, carrying risks, having no immunity into places where there are these diseases. They farm, ponds of water sort of open up that it didn't used to. And then there are other crazy predictions. And so there's all kinds of reviews that have come out. And again, in the interest of time, I'm just going to go skipping through that, focus on my case. I have looked at this phenomena in other settings in India and Brazil and Indonesia at different scales, globally, very micro within some communities, and then across entire countries. So the fact that we are finding some consistency depending on changing entire continents and changing entire scales means that there's something going on there. Okay. Which I label it exploratory because we've never nailed it down. Is malaria a big deal? Potentially half the world is a threat. It's very, I teach an environmental health class, and invariably when I ask people in the first class, what is malaria, they say, what? So there's lots of people in the US who have no idea what this disease is, never had it. 99% of the classes have never had it. So there is a disease out there that's potentially affecting half the world, but 99% of any classroom will not have this disease. So it's helpful to remind people that this is killing a bunch of people. Every year, this would be a genocide by most terms. 2 million deaths a year. Okay. It is coming back. Not only is it not gone away, if a guy getting on a plane in Kenya gets bit shows up in New York, and then all of a sudden it's a problem that no one can deal with. Okay? Especially with the way we deal with it right now is take 15 chemicals and mix them in different combinations and try. Those guys are also, the bugs are sorting this out in their head, and they're certainly developing resistance to this different cocktail therapy that we keep throwing at it, so we won't solve this forever. There are major challenges to the usual ways we have tried to control it. This is the combination therapy I was just talking about. This is treating mothers when they're pregnant with drugs, the sprays that we are doing, which are killing other things in the process of killing the mosquitoes. So the question has re-arisen, something we used to do earlier. Can environmental management, sort of cutting across things like preventing deforestation, help at least give these guys more time to deal with more biochemical solutions to this? I think Joe and I have written a paper where we try to make this out. And the names that are usually associated with this are Dick Levins, Bert Singer, Utzinger, Junko Yasuko. There's a whole series of papers where they've systematically sort of gone through this literature, gone through historical literature. It's in brown because I don't want you to focus on it, just to show that it exists. I don't have the time. Non-toxic, cost-effective, sustainable strategy could be highly effective. That's what when we looked at the eradication, what was done in the camps in Tanzania and on the plantations. When we looked through sort of a whole host of studies, basically the bottom line is that it's a pretty complicated link between mosquito ecology and malaria. It depends, some mosquitoes like sunlight, some don't. It depends on the land use that follows, it depends on whether people walk in and out of these settings, and so generalizations come at an expense. My own take is that there are reviews of case studies and lots of soft analysis, including ones that I've done, that suggest correlations. Mostly they don't test hypotheses, they generate hypotheses. They're set up like, oh, okay, I got deforestation here, I've got malaria, and these are correlated. Yes, that's it. They are correlated. Maybe there's something worth studying. And so we are trying to argue for a program of research. So when Bill Gates sits down with Gordon Moore, one cares a lot about health, the other cares a lot about the environment. They should consider giving Gandhi a bunch of money to go study this in a very structured manner.
Amen.
Different scales, compare a full comprehensive list of covariates, not just one-off thing that you sort of care about. And look at specific policies. What should you do rather than generally reverse deforestation? There's a lot of things you could do to reverse deforestation, but if you do specific things, maybe those are more health-friendly than other things. Okay? And so our analysis kind of speaks to this. Why Brazil? It's a deforestation hotspot, so if you want to look at the effect on malaria, why not start there? Because then you can make another case for stopping that. Some reality checks, it does have data. You can't answer this question conceptually, you can answer it through data. This is a place where if you sacrifice enough summers hanging out there, making friends with people, you will get data. And it has is now becoming rich enough to actively pursue an active conservation agenda. They have the liberty to declare 50 million hectares and protect, how many places are left where you can do that? And so now's the time, then if you can show them that there's some additional benefits, maybe what about these areas in there? Oh, okay. This table is just to tell you that there's lots of variables and we just don't have deforestation. It's not like we're focused on malaria and deforestation. There's other things that matter and we consider them. Okay? For example, the 3 different kinds of protected areas. There are protected areas and there are protected areas. Some that allow you to use them, some that don't allow you to use them. Some that belong to indigenous communities that have lived there for a long time. Some are roads-based policies. Livestock, migrants coming in and out, population density, wealth, inequality, the usual family health facilities, and of course, when you talk about malaria modelers, they're only focused on those last few things, rainfall patterns and temperature, and that's how they're making predictions about what will happen under climate change, without fully telling you whether these donkeys and cows and people will respond to that in any way, okay? So our story is that it's a multifactorial thing. Just a few slides back, I said it's highly complex, context specific, so at least try to get at a few of those highly context specific things, all right? I am going to skip this. There's different ways to do it. Some of you are statistically focused and some of you are not. If you have our unit of analysis is a municipality. Just think of that, and some of them are bigger than counties in Vermont, some of them will be smaller than counties in Vermont, so they're inversely related to the population density. And you have a bunch of them at different points in time, 2002, 2003, 2004, 2005, 2006, 2007. So it repeats, okay? So how should you analyze this data? You could say, well, I don't care, I'm just going to dump it all in and study it. That would be the OLS strategy. Otherwise, you could say, well, there's something unique about it county and it's kind of different. You would do sort of a random effects type of model. Or you say, you can put deforestation in there or protected areas, but there's something unique about every place. So this is more of an anthropological story, and that would be a fixed effects analysis. So then you're looking only comparing the malaria transition within a county across time rather than across space. Now, this is actually a deep philosophical question for us ecosystem services modelers. Do things across space matter than within space? And I don't know. I don't know if that stuff that's missing is much more important when it's within a place repeated over time or across spaces looking across time. Okay, so this is it's an argument between the sciences in some ways. What if that stuff that you're trying to study is correlated with this thing that's missing about a space? Okay, and so some of the economists think that that has primacy. Some of the other ones think that whatever that is not correlated with what's missing. Okay, so this argument rarely goes away. The problem with us is that many things we care about, policies, something about the space, something about nature, cannot be analyzed with this because it's swept out. And so this is not a good model for looking at multi-level, the high level unit of analysis, okay? Where policies or drivers are slowly changing, or they're not changing enough for us to sort of detect the effect in one place over time. So we don't use this method. Okay. We find an effect. Okay. What is that? Malaria is negatively correlated with strict protected area. If you have protected, a lot of that county sort of tied up in strict conservation, then you see less malaria. If you have indigenous territories sort of dominating that landscape, you see less malaria. If you have fewer roads, you see less malaria. So that means there are public health impacts of typical infrastructure and conservation policies. So if Gates is so interested in solving the malaria problem, he should talk to Gordon Moore, who is actually helping sponsor some of this stuff. It's not that we just find this effect and we don't worry about other stuff. We also see the usual things that the climate guys would have argued. Rainfall and temperature explain things. The elevation explains things. The size and the density explains things. People who work on mining, you'll see the same thing. Where you have more mining, you'll see more malaria. So over and above the usual suspects, this relationship is holding. So that's something worth studying. And so obviously, when we go to the journals with this, what is so different? Most places have, most other studies have just a few cities or a few counties. They're not looking for the entire Amazon biome. There are a few covariates, not a whole long list like we threw up. And they look at a cross-section, we look across time.
Good question. Do you know if you control for the population density, you find the same effects, or have you tried to control?
Yes, population density is part of one of the covariates. Yeah. And we've tried other things, and we kind of find, its basic finding holds up to different ways of monkeying with this. I don't want to claim that we just did one regression and declared victory and called it quits when we were ahead. We're looking at dengue. similar patterns. It's a master's thesis that we've been holding from publishing yet. We look at other sort of deforestation-related diseases. We haven't around enough hours in the day. This is when Taylor has all the money, then we take on all these other problems. We are looking at things as some of the policies were, some of the parks were established early and some were established late, so we can actually look across time and get into that fixed effect methodology that I was talking about. And really, the one that I'm most interested in is trying to map out unofficial roads, because that's where the guys are going in. The official roads are the big highways with trucks and logs going in, but the little roads here and there, the miners are showing up on that. But there's a reason that no one wants to show you the unofficial roads, because that's where the illegal stuff is. So more summers in Brazil. So now the 5-minute reflection. So these guys, if they, every now and then you'll see a letter from Bill Gates to the rest of the world about what he's been doing in the last year since he stopped flooding our system with these gadgets. Right? So, and he'll say, I've been working on the vaccine and it's about to come. Right? That's the way we'll solve it. And I don't know what, does anyone even know what Gordon Moore looks like? All I know is there's this big foundation that people like us go to, but they are very into conservation. Yeah. And they have almost like carved out the philanthropical world and said, you deal with health, I'll deal with environment, let's not talk. As if there is no overlap between environment and health. So, but if they were having a conversation, what would you do? Maybe they would ask this question. Can protected areas deliver health-related ecosystem services? Huh? And I would say, yeah, maybe. Okay. Shallow empirical based, patchy data, sort of flawed methods, but we need to move on. Okay, so I have Brazilian panel suggests yes. Indonesian panel suggests maybe. We need to study this definitely. How valuable are these? I mean, so we've got cases reduced. Should we, these guys talk in terms of investments and returns, and so they've just given someone a bunch of money to help put conservation efforts on the ground. Is that worth it? I mean, you've got cases of malaria reduced. These are poor Brazilians. What's it worth? I'm not going to do a crash course in non-market evaluation, but you could do that, right? So there are estimation methods, and then there are calibration methods, and those could be done. And we've done it for like diarrheal disease in Flores in Indonesia. What is it worth? And you could go through that exercise. And so this is the outlines of a proposal that Taylor is going to submit now, right? So he's paying attention. So should we build a research program? Yes, of course we should build a research program. Invest in data sets and methodologies that can't study these. You need variation because you want to estimate some relationship, either across time or across space. Multivariate, it's not just two things, deforestation and malaria, it's a bunch of other stuff. And some practical statistics, because some of the things that we care about, policies, don't change often enough, so we can't just track the effect. Well, he already did that. This program that at least Taylor's involved with, that produced that paper. And I'll just offer you my reflections on what I think he could have done better. In any way, this is going to have, as a research program, is going to have high payoffs because guess what? If North Carolina can get 12 snow days, it's going to get really bad hot days soon too, and this stuff is going to start fluctuating everywhere in the world, and all this research program is going to have a payoff down the line. Okay. What HEAL didn't do so well, and so it has sentinel sites, Indonesia, Brazil, Fiji, somewhere else, NPAs, Indonesia, I guess, yeah. And different kinds of diseases. It's not very good about what people should be doing and how they do it, and whether it's individuals. Okay, if I'm getting a lot of malaria, I start thinking about buying a bed net. If I'm getting a lot of diarrhea, I go try to get clean water from someplace. That is not very well captured. Okay? Why would you study behaviors? For example, in epidemiology, they certainly recognize that people are not passive acceptors of threats. If you do simple correlations between air quality and physicians, you might get this crazy, I mean, I think most of us believe that physicians cause sicknesses rather than solve them, but it's not entirely true. So you might find those correlations if you just ran some silly regressions, right? So
Am I the only person who doesn't know what endogeneity means?
endogeneity would be that it's circularity in that what you think is, so you think that the disease is cured by the presence of physicians. It could be that the physicians are responding to the disease, so the arrow actually points in the other direction. Right? So this is just going back to saying that some of the behaviors we assume as given are actually responding to the outcome that they're supposed to be solving. So I think that if I sleep under a bed net, I will have less malaria, right? So if I'm trying to look at the effectiveness of malaria on bed nets, my decision to sleep under the bed net may have been caused by previous malaria rates, and so I will confound. I will not see an effect, and there is actually an effect because I've already adjusted for the fact. This compensating behavior. Okay. So behavior in my, because of this sort of circularity, is a classic confounder. It's correlated with the outcomes, the environmental risk. Okay? It's not necessarily in the causal pathway, and it may be unbalanced across levels of environmental risk. So when we say deforestation, disease, air quality, disease, there is this human behavior in between that is confounding. When we don't see the disease effect, it could be because they've adjusted already. So they've already paid the cost, we're not noticing it. Right? This is what my program would look like. I would have cross-country analysis. I would have regional analysis, like the Brazil example was an example of this. And I would have household level analysis, the kind that Alicia and Taylor and Brendan are sort of doing with DHS. Okay. I would do statistical projects. In some cases, I would do simulation studies because we won't have the time to come up with the parameters. And we can, instead of, there are the reviews of the kind that we just looked at, but there's also, you could do structural meta-analysis. Now there are studies populating it to see if there's a general relationship. Okay. Not going to talk so much about the valuation part, but okay. You're all very smart. You can read this very quickly.
Not that good.
Anyways,
You actually flipped ahead, I think.
no.
Oh, okay.
We all got it, Josh.
So, yeah.
Well, good. Maybe we want to open it up to questions. Thank you. So yeah, do you want to?
Joe?
So what are the, I think I know, but it may not be clear, what are the mechanisms that are making protected areas, why is there reduced malaria around protected areas? What are the hypothetical reasons for that? You're saying you use the ways of bringing up
Should we just look at the Ponsiri Roman?
yeah, I can read that, but no, so I mean, what are they?
So I think there are three potential, or 3 or 4 channels. Right? Let's go back to why does malaria cause, why is it a disease risk?
Because protected areas have intact ecologies where the mosquito is suppressed.
Yes. So it could be this channel that was just mentioned, okay? It could be something to do with protected areas have still things that are eating up the larvae. It could be that they're keeping the people out. So if you notice the sustainable use protected areas where people are allowed to come in and out, you actually see malaria going up. So they are exposing themselves. The strict bound, so this is actually not a very good message because other places have said that sustainable use protected areas might be the way to sort of deal with some of the concerns of the local people that you can't shut them out. You know, what is this? You guys are walking in here, and so in Taylor's review piece, they say health for whom. So this could be you. Yes, you. Some people lose and some people gain, and so that. So it could be any one of these channels. Okay. The fact that we find differential effects for the sustainable use, the one where you get access inside the forest, versus the strict protection, is indication that one of these channels is in play. The other fact that you find migrants, the indigenous territories being more protective because they, in the sense, they're used to that. They're not that migrant population that's on the move, whereas it's the new sort of forest users who are coming in and out.
So do indigenous populations have lower malaria rates? They're
To start
living there
with?
all the time.
I,
in Brazil, have you guys looked at
Well,
that?
there's huge resistance, right? If you
In-
live
Yeah.
Because it's
in endemic areas,
uh-huh.
anyone builds resistance, whether they're indigenous.
In the short term time period, because indigenous would have been, I mean, for some of these
Within
malaria
their
strains, they're
lifetime.
invasive. They're only here a few hundred years.
No, within your lifetime.
Within your lifetime?
Yeah.
Yes, within the lifetime.
I see.
For
And the
example,
other-
like most South Africans have some inherent
Mhm.
resistance where we don't, even though they're not living in an endemic
And
area.
the other problem is the symptomatic versus the asymptomatic immune system. They don't even detect it because they don't want. But the main threat for malaria, from the way I understand it in this population health environment framework, is the migrants coming, especially the logging and the mining companies and people working on the mines. They're on the move, right? So they carry the disease further and further. They have no ability to sort of deal with the local setting, and they're on the move. And so the health services can't catch up with them either. So in fact, now they're taking it to places where there didn't used to be malaria because those people, it's sort of Jared Diamond played out again. It's just in a different.
But just following up on that, how much of that is roads? Because it seems like roads are really big for this affecting it, so that would confound things. So it's not just
No, it's
people
not
moving in
confounding.
and
If we
out.
have roads and it's significant and positive, we control for that.
So even with
Even the
the
roads.
same road density in super protected areas and sustainable use areas, you'll find that difference?
Yes, so, no, but yes and no. Yes, we control for roads, because in our analysis, we understand that roads are hugely important, and we see that it has, over and above, a bigger effect than the protected areas.
So it has a bigger effect than the legal status of the land, right? That's what, okay.
But that said, I mean, your ideal experiment, which we would like to have, is some protected area with roads and some without roads, but the real world unfortunately doesn't organize itself into these experiments. So we're just looking at the net effect of this. So, yeah, we don't have the perfect cross-cut
Right.
of, yeah.
Well, I
so-
was imagining you might have good data on roads, but not good data on human movements, and so.
Oh, yeah,
one
yeah,
you
it's a
could-
proxy,
One you
right?
could sort of sort out its influence statistically, and the other one it might be harder.
So the thing to do with that is if you could get road layers that change across time. Typically you'd go, pull up something on ArcGIS and you've got a road layer and you clip it to the municipal or the county. It'd be nice if you had a 1990 layer, 2000 layer, 2010 layer, but you can see how the density has changed, and that has some proximity to movement, right?
Right.
And then what I'm trying to say is, even that is not my dream goal. My dream goal is the unofficial roads that are
Right.
not the paved ones, that are what people who are exposing themselves are doing.
And then aren't
We
built
have
right.
unofficial roads, but for a subset of counties. So this is the usual statistical nightmare that you do that, you get better quality data as you go find resolution. We were talking about this last night, walking up this hill here. But then you lose sample size, and so then you don't know whether if something doesn't work out, whether it's because of the 200 communities that I lost, or because, so we do have some unofficial roads. As of this morning, I was Skyping with my collaborator in Brazil saying, what's the deal with this?
Well, I was guessing the unofficial roads also for the biophysical reasons would be particularly problematic because they're often built without any drainage.
That's right, that's right. So that's where the action is.
Right.
In that, for all kinds of nefarious and not so nefarious reasons. And there's a reason you don't get that data, right? Because they are extracting things they shouldn't be and putting them on those roads and getting them out of there, so they don't want it detected. And so it doesn't get onto the government maps. And
Right.
so, I mean, on the other hand, you were talking about the Moore Foundation stepping in, and so they could give us helicopters and
Used for drones.
drone striking logging trucks.
Okay, here comes the skepticism, and I always suffer for this. The last time I was here, I suffered for that, and last night with my wife, I suffered for skepticism, but anyway.
But that never stops you. That is
Safe space.
That's right, you're right, I'm not learning. If I were advising Bill Gates, I would say, well, there must be some sort of model we can build now, it's very fuzzy, and it would give us an indication of the relative effectiveness of various measures. And when I hear this, I think two things. One is, it sounds like an intact ecosystem doesn't give zero malaria, and that is the goal. And second, this idea of the roads and all that, I mean, that's what we want. We want to develop the world. We don't want to destroy all the intact ecosystems, but we want to destroy most of them. So when you kind of put that on the map, it seems like you just might not get a big yield because of growing population, expansion, roads, and all that stuff. And so if you did the, pardon me, cost-benefit analysis, you might say the vaccine is still where to put it. In other words, there's a contradiction here, it seems to me, between the idea that an intact ecosystem will be helpful and development goals, which generally push in the opposite direction,
So,
especially for a developing country.
yeah, I think there's three responses to that. One is that the way that some of the early literature brought up environmental management just as a public health strategy is that the vaccine folks need time. We can buy them time. And they need maybe complementary inputs. Their job would be easier if there were other things that were also reducing the overall level. Okay? So it's the same way that some of my other work on stoves and black carbon is just to give you time to get everybody to become Vermont, right? And bicycle to work and all that. They're Texans and take time to convert those.
So it should be a time-dependent model.
I agree.
All right.
Yeah.
Okay.
So one is the time story. The second thing is that vaccines haven't done all that well. Okay, there's been a mixed history of how much they penetrate and whether they are what they're cracked up to be. Okay, both because of people resisting and not taking it and sort of hanging out there, and then these things having side effects. And, okay. So that's story number 2. Story number 3 is that, so 2B is that I actually don't believe that eradication is possible for some of these things because people will figure it out and then N-1 will say, I don't need to do it. Everybody else is protected around me. And that same stupid dynamic will play to person number 2 off the list. And you will hope to hit 70%. You'll never get for some of these diseases. Okay? These big number diseases. The ones they've eliminated are the ones where polio, or I mean, it's easier to sort of deal with in some ways. The fourth problem, I think, is I forgot. I mean, yeah. This is along the lines of what Taylor and all wrote. I mean, I just showed you the malaria story. There's a story for pneumonia. There's a story for fire-related health effects. Okay. So we are looking at protected areas not as the sole source of health delivery. It's that you get the species that you wanted to save, the hydrological services. So when we're doing this nature's bookkeeping, there's a bunch of stuff. And someone has to start with the health, and you'll get a small number here, yes. But you'll get another small number from the food and fiber and nutrition effects, then you'll get another small number. And pretty soon those small numbers, if just added linearly, would be a big number. But added in complementarities, because multiplication is not possible. If you're not suffering from nutrition, then you might actually respond better to malaria. And you might be more productive in the workplace, and then you may not do all these crazy unofficial road activities. So I don't even know what the nonlinearities imply. So you know, this is just a first pass. I think they should talk to each other, for one. The fact that they don't talk to each other is a bad idea. Especially because they work in places where each has interests. And they pretend that the environmental world has got nothing to do with the health world.
Well, just can I pick up on a thread there from Bob's comment and just say, I think I'm really curious about, are there any times when pro-port ecosystem services are working at cross purposes? If you're
Yes.
saying we want people to be using the forest for bushmeat or for light timber harvest or non-timber forest products, does that increase their exposure? And then, so it's not like we can just add up all those positive ecosystem services and
We
say,
put in massive infrastructure projects without doing full-scale health assessments of their implications. So we do large-scale irrigation, drainage projects, we do lots of road building without thinking through. So, so the last thing I remembered on this point was that when ADB was putting in new roads, the Asian Development Bank, that's like the TARP of Brazil, okay? They asked us to, there are good roads and there are bad roads along the lines. Because roads also do bring doctors and they bring teachers and things like that. And so we said, can you do smart roads? I mean, in some places, the good things should, not just the logging trucks and the prostitutes and this, there's other kinds of roads, right? So can we sort them out and study them in different contexts? And we had a couple of conversations and the loan officer had made the loan, they didn't really care whether it paid off. Brazil was stuck with the loan and that was the end of that story.
How many, you mentioned dengue as well, and I was wondering if you've done some sort of calculation of how many diseases, how many risk factors were actually associated that you could model in this situation?
So that unfortunately is a data-driven story.
Yeah.
So the usual when I say Brazil has public data that's reasonably easily accessible, it's the big ones. So it's a couple of the vector-borne diseases, not the neglected tropical disease. So that would be malaria and dengue. It's respiratory infections, cardiovascular, diarrheal disease. Okay.
So you can do, I mean, you could do cholera and that would.
No, not at that fine scale, no way.
No?
No,
Oh, okay.
not that fine. So we could only do it very crudely. I mean, this is the trade-off. You could go into one community and do that very closely and wait for time to happen, and then when you're all white-haired and all, you can go back and repeat that. Or you can grab what you can and try to make at least the first cut preliminary analysis to pique people's interest and then say, we should fund those fine-scale analyses. Right? So we are being constrained by the data, and we're also, but we're not superbly, when I put up that global burden of disease calculation, these are the top hits. Malaria, diarrhea, pneumonia, malnutrition are the ones that feature most prominently. So we.
Can you flip back to that disease list where you had diarrhea at the top and just secure?
That's actually changed rankings recently, I think.
There was one cancer on that, by the way. It was
At the bottom one.
At the bottom, yeah.
so we've got about 5 minutes left, so I just want to make sure we kind of get the big questions out there.
Yeah, 'cause just looking at that, I mean, if I was thinking how would Bill Gates and Gordon Moore respond to diarrhea, it seems to me they would focus on getting Brazil to enforce their forestry code, 30-meter reforestation along all their waterways in the Atlantic forest. And, that would have, seems to me, that biggest, tightest link to, the ecosystem service and the diarrhea and the existing laws that favor it.
So Josh, I think since this came out in 2004, it's been 10 years, and Chris Murray has a new list, and pneumonia is on top now.
Pneumonia.
So respiratory infections.
From the smoke and everything?
Yeah.
Wow.
No air pollution. So things change in that world. I mean, some of that is obviously politics of the researchers and who's sort of arguing for what, but diarrhea slipped off the list. It's not, it's a bit absurd, but anyway. So they would have made a wrong call if they were listening to good things.
So, you guys have questions?
One more small question about your model. It's, well, maybe you were trying to explain this in the endogeny slide, but I didn't quite follow it. You don't control for mosquito nets?
There is no data on mosquito nets that's Brazil-wide.
Oh, okay. It seems to me, I mean, because I don't know if it's true, I'm no expert, but the storyline is the #1 most effective approach against malaria and dengue that we have right now is just simply mosquito nets, including for indigenous populations. And then there's the
So
vaccines.
the story you want to tell me is that protected areas are less likely to have mosquito nets. Communities the counties that have more protected areas are clearly more likely to have mosquito nets, and therefore what I'm calling the protected area effects is really mosquito net effect. That's the point of regression analysis, that the stuff that's left out has to be systematically correlated with the stuff left in. So you tell me what's a good story about why places that have protected areas have a lot more mosquito nets also. And so when I'm finding that correlation between protected areas, it's because of the mosquito net uses.
Well, I guess you don't have the data, but if you had the data, that would be something to check, because that could be the skeptic's argument is that, isn't it just
No.
more effective just to
But usually, so usually mosquito nets are correlated with education levels and wealth. I mean, I do micro work, I don't do this most of the time. That's the story. The toilets with bed nets, with tap water, filtration devices. We do surveys house to house, and that's what we find. Education and income is included there. So it's got to be some other mechanism that's correlating protected areas to the ownership of that. In any one of these complex models, there's going to be a bunch of things that are missing. The story is that that stuff that's missing has to be correlated with the stuff that you've included and are claiming is causing the relationship, right? So in this case, it has to be the case that the bed net ownership is positively correlated with the presence of strict protected areas.
For it to be a problem.
For it to be a problem in this analysis, for the inference of that. So over and above the influence of income and wealth and inequality, I find that hard to believe. Of course I've gone and looked for that data, but you're looking for mosquito net ownership year to year over a 5-year period. That's just tough, right? I mean,
So can I bring up one that I think might be correlated and picks up on Josh's statement, and you answered a little bit about the population density. So I was struck by the reasons deforestation might lead to more malaria. And a couple of them you could argue are ecosystem services, right? The theme of your talk. More water, more sunlight, so the abiotic factors are there, and fewer dragonflies to hoover them all up, right? So those are things the ecosystem's doing. But this big one that really is bothering me since you put it up there is there's just more access to the forest. And I don't think that's measured very well by population density of the district or roads or something. It's just probably going to be the case that people are now more exposed. And that's not an ecosystem service argument. That's just an exposure change. And so have you been able, how much do you worry about that?
what do you mean by people are just most exposed?
The deforestation is allowing access to where mosquitoes are now breeding where that wasn't true before. Right? So there's it's like,
but it moves in the same, Taylor, it moves in the same direction as the channel that I'm looking at. I'm not trying to break down the mechanism.
but it's kind of like saying, you know, there's a smokestack blowing smoke downstream, downwind, and people are getting sick downwind. And some things could be, you know, trees could pull that back out. But what you've just done is move a lot more people downwind of the smokestack. So of course there's more people getting sick. What you've done when you deforest is you've let a lot of people walk around near all those new puddles where they couldn't before, and there were no puddles, so it's compounded. So how much can you pull that out? Because that one is correlated with deforestation, right? So
that is deforestation as a risk factor. Deforestation is not the lack of forest cover. It is the beginning of a series of activities,
Right.
which you've named.
right.
Some of them have nothing to do with the environmental media, which you think is going on. But we've got things like migration in and migration out,
Yeah.
and population. Something that is so closely related to the deforestation activity that it might be causing a correlation is probably worth bundling with deforestation at this point, and at this level, that scale of analysis.
Yeah. So that just, yeah, that all seems fine, it's sort of understanding the phenomenon, but it becomes a weaker ecosystem service argument. It might have nothing to do with the special things that forest is doing to control mosquitoes. It's just that when you remove
Taylor,
it,
you could do it at the country or biome level scale. You can do it for
But,
little villages.
Yeah, I mean, I thought one of the problems was that when you deforest, the vector population actually increases and the incidence of malaria in those vectors increases.
Correct.
So it's not just that you're going into, like if you started going into a forest, you wouldn't have the same effect as if you deforested and developed an area, right? So you're actually changing the vector population and the disease burden on that vector population. So therefore, you're getting higher
Yeah, but you
exposure
can't see
levels.
you can't see that change in the statistics that he's done.
Right, no, and I
And
understand
that's
that,
what
but that's
Taylor's
like
saying.
the
Yeah.
argument against what Taylor's saying, is like, it's not just an exposure thing, it's actually
A
the
change.
act of deforestation that's changing the ecology of the system.
You wouldn't take that question on at this scale, but if my unit of analysis was villages and people, I would try to do that. But even that, I would say, is a tough act, because you're asking them to report back spatial diaries.
Yeah, where they
Okay.
went, yeah.
I do that for air quality. The cost of the research exercise far outweighs any benefits. If you want to move the ecosystem health research agenda along, and you just ban 90% of it on the equipment that is just going to chase people around the place, you sort of lost the story. Because by the time you come up with the analysis, you got some small little thing to prove, and it's just sort of you lost the story. I'm telling you, I mean, we ran this big stove study, and 90% went to this fancy equipment, most of it was didn't work in the field, and it didn't really prove anything, but people move around. I knew that. What did you show me for this all? You know, earlier I had sort of roughly air quality in the room. That was doing fine. Now they're moving around the house, and it's all terrible air quality, so what difference does it make if they're in room B versus A? The same sort of thing, I mean, I guess we could do it, but I'm not so sure that's where the payoff is.
We should wrap, just so that people
Yeah,
can
I'm here
go.
for answering more questions, but if
Okay, we also, I think you've got another meeting after this, if someone's in
Right.
charge of your schedule, so we may have to rush you off some of those. But let's, please join me in thanking our speakers.